Mr. Secretary, it is so great to see you. I will echo the kind words of my colleagues and just how excited we are that you're serving as in the Biden cabinet. You're going to do remarkably well. We know that. Mr. Secretary, I'd like to cover the Center for Disease Control Social Determinants of Health program. And I also want to throw out my thanks to Chairwoman DeLauro and also to Ranking Member Cole. With them, we have been able to stand up a $3 million program that's based on legislation that we wrote out of my office called the Social Determinants Accelerator Act. And so the program provides grants to state and local governments to develop plans to combat social determinants of health, like food deserts that we see in a congressional district like mine, long drive times to doctors that you see in very rural congressional districts, and they're negatively impacting health outcomes for people. I cannot tell you the level of excitement that I feel when President Biden announces a $153 million request for the program this fiscal year. Mr. Secretary, a few questions. First of all, as part of last year's funding bill, we directed Health and Human Services to create a social determinants interagency council that would be made up of representatives from Health and Human Services, education, labor, and many others to help communities applying for these grants. If you could, do you know the status of the council as it stands right now?
Congresswoman, great to be with you. And believe it or not, I don't. And I'm going to admit that I don't, but I will check with my team because, as I said to everyone beforehand, we're going to be on this one. And so I will get back to you quickly on that.
Okay. We will wait to hear back from you. And it makes me feel good that you're committed to making sure that that gets up and running, and if it hasn't already. But I don't know the status either, and because it's a bill that we wrote out of our office, very, very interested in knowing that.
Congresswoman, you had me at hello on that one.
Okay. All right. Look forward to talking with you more about it. So when will local communities, if you know the answer to this, if you know when local communities would be able to apply for the $3 million worth of social determinants grants, I can tell you this. We have heard from many of our communities in the congressional district that I serve in Central and Western and Northern Illinois about their interest in being able to apply for grants. Anything you can maybe let us know about that?
Yeah, and you are really getting granular on me. And as much as I did a lot of homework to prepare, I can't give you the answer on that, Congressman, but I can do this. I can make sure my team is taking notes and we get back to you as quickly as we can, because although we've got a budget, we're talking over $130 billion, $3 million for a lot of communities is going to make a big difference. So we'll get back to you on that.
Absolutely. Okay, so let's then shift to kind of a bigger picture part of social determinants. With President Biden's announcement of $153 million that he's requesting in his initial budget, how that would has the possibilities of assisting so many communities around the country. I'm guessing you have been involved in those discussions with President Biden. Can you talk a little bit about how you envision that working? What are the next steps? What would you like to see happen with this $153 million? You probably even know how the $153 million number came to be, but if you can talk a little bit about that from a bigger picture perspective.
And thank you for that. Let me give you a sense of how I hope to approach this. One, can't use a cookie cutter. What works in one community may not work in another. Two, you got to look at every corner, because we often miss those corners where communities are trapped, and if you miss them, then you've really not dealt with the whole issue of healthcare and making sure that you're dealing with social determinants of health. So make sure you turn over every stone. Three, we're not going to know how to best do this from Washington, D.C. And so that means partnering with the local communities to ask them, looking to the people who are respected and are the leaders in the community to help guide us on how we're going to do this work, because they're going to know where we're lapsing, we're not doing as well as we should when it comes to addressing the social and healthcare needs of communities that have been left behind. And so working closely with partners at the local level, turning to respected leaders, making sure we don't assume that the communities in that corner of the region were already addressed, and making sure that we're doing this in a way that we partner with everyone who understand this, we're the experts. We should be able to come up with a good way to address this. And at the end of the day, as I said earlier to some other questions, to me, accountability is so important. I want to show that we delivered on our dollars, and I want to make sure that if someone gets that money, that they delivered on that dollar as well. Taxpayers deserve that.
Well, again, Mr. Secretary, thank you so much for your commitment to this. I look very much forward to working with you. And I know you've gotten many invitations already, but would love for you to come to our congressional district and see some of the struggles that so many families and individuals are going through as it pertains to access to health care and just some of the struggles. But thank you. Wonderful to see you. Madam Chair, I yield back.
Thank you.